My name is Pauline Tully TD for Cavan Monaghan, but I'm Sinn Féin Spokesperson for Disability and Carers, and I just want to thank Jamie and Deputy Mylan for the invite to come here and speak today. And can I just say, I've listened to all of you, and I've been to many meetings like this, both online and in person, and I engage on a constant basis with groups in my own locality on this issue as well, the issue of disability. And I've heard, unfortunately, the same from everywhere in the country. Now, I think when I look at it there, because I think Amy or someone mentioned there about things haven't changed in 20 years, or maybe they've got worse. There's an organisation in Cavan called CAPS, it's Cavan Autism Parent Support, and they were established around 20 years ago, and the person who established it, Bernie Nelson, she said to me, "That was me 20 years ago, when my child was 4 or 5, he's now 24, 25. And she said she had to fight for everything, and she had to set up an organisation to provide support. And they still provide a parent support group, they still provide Saturday clubs and summer clubs, because nobody else was going to do it. Now, I suppose we hear a lot about the progressive disability model, and what I feel about that is, a few years ago, you had disability services, you had the early intervention teams, and then you had the child development teams. And in some areas, you had very good teams, other areas mediocre, and other areas very, very poor. And the whole idea behind setting up the progressive disability was to make it good for everybody. What it seems to have done is made it the same for everybody, but at the bottom level, where there's very, very poor supports for anybody. Now, I was speaking to Minister Donnelly about this, I've spoken to Minister Rabbit. They keep saying to me, it's not money, there's lots of money there, we just can't get the staff to recruit into the teams. And I've looked at this, because I'm on the Disability Committee in the Dáil, I'm also on the Autism Committee, and we're hearing all the time from people with lived experience about what the issues are. And I've talked to psychologists and other therapists and the societies that represent them. When progressive disabilities was being rolled out, there was no workplace planning put into it in the first place. But they also decided to introduce a different standard operating procedure, where they introduced a preliminary team assessment. The society said to them, we're not going to stand over that, that's undermining our professional standards. We will be leaving the teams and we will not be participating in this if you go ahead with this. They went ahead with it anyway, and a lot of the professionals walked away. Now, a High Court judgment there in March actually deemed that preliminary team assessment not to be compliant with the Disability Act of 2005, and that it's no longer permissible. I don't know if the HSE have engaged with their former employees, but they need to, and get them back into the teams. There's a pay disparity between Section 39 organisations and the HSE. Until that's addressed, you're going to continue to lose staff from societies like United Enable Ireland, who are probably the largest Section 39 providing services, to the HSE or to the Section 38 organisations. And until they do so, that's not going to happen. The HSE have a terrible, cumbersome recruitment process with this panel system that no health professional agrees with. They need to get rid of that and let teams recruit locally. They also, Curo, which was established, it takes forever, months and months for them to actually state that somebody is qualified to take up a position and to allow them to be registered. I know, Jamie, you mentioned there about people, say, who train in the UK and want to work here as speech and language therapists, and there was one module that they didn't have. And actually, Anne Rabbit said last week at a disability meeting or an autism meeting, I can't remember which one of the meetings I was at, that's changed, thankfully. Common sense prevails. They're now going to provide the on your work, when you're working in the position, that you'll get training for any modules that aren't covered. So that's a positive as well. But there are so many simple things that they could do. I mean, it has been brought to me at meetings like this, why not have assistant posts to occupational therapists that could do some of the work? More administrative staff, because it's ridiculous that therapists have to do all their own administrative work, and get the administrative staff in to alleviate it. Have they looked at weekend work? Maybe contracting people to do the work at the weekends to reduce the waiting list for assessment or for services. There are small things that could work. The therapists were withdrawn from special schools, and despite what's been said, they have not been allowed back into the schools. I think a better model would be to look at trying to incorporate some of the therapies into the schools. Minister Abbott said when progressive disabilities was first rolled out, it was supposed to offer parents a choice between school and home as to where the therapists would be, or therapies would be offered. The school part seems to be forgotten about. So, I mean, look at that again. Why take a child out of school maybe to travel miles to attend an occupational therapy or a speech and language therapy appointment, and then they're missing out on school? Why not offer them in school? And I'm not talking about the social inclusion model where the therapist goes in and talks to the teacher about the students, and then that's supposed to be seeing the students. I'm talking about going in and actually engaging with the students in schools. It's something that could be done. But, and many of you have brought up about other issues around disability, like the cost of disability, and that is huge. The Disability Capacity Review was published roughly a year ago, and then the Independent Cost of Disability, which was carried out by the Department of Social Protection, was published towards the end of last year. The implementation plan for either of them has not been published as yet. That will be promised that the Disability Capacity Review implementation plan will be published within a matter of a few weeks. But it identified a huge level of unmet need, and until that is properly addressed and a plan put into place of how to address that, nothing's going to change. Also, on the cost of disability, I think it indicated that anywhere from 8 to 12,000 on average, so that's average, so it could be more for some people and less for others, depending on the nature and severity of the disability. But that was the additional cost per family with a member with a disability compared to a family without a member with a disability. There needs to be a cost of disability payment. There needs to be an increase in the payment given to disabled people. But also, there needs to be put in incentives for disabled people to work. I talk regularly to people who want to work, but are afraid of losing their basic payment, especially maybe self-employed or artists or musicians and that who work on a contract basis. And they're afraid of losing their basic payment and afraid of losing their secondary support, such as the medical card. It is huge. So I think all disabled people should be guaranteed a medical card and a basic payment. And then if they wish to work, well and good, let it be taxed the same as the rest of it. They shouldn't lose their basic payment. There are simple things that could be put into place that make sense and would make a whole world of difference to disabled people in this country. We ratified the UNCRPD in 2018. We need to ratify the optional protocol without delay, but also we need to implement that. We need to ensure that disabled people have the same rights as all of the rest of us in this country. And we should be proud to be Irish people in an Irish country. We shouldn't be ashamed, and we are. We are ashamed of the services there. But I do agree with people who've said it's not a political issue. I don't work with anyone. I regularly talk to the ministers involved with this, and I'm happy to come forward and work with them on solutions and with, more importantly, disabled people and their representative organisations, because it's people with lived experience who know what needs to happen. Okay, thank you very much.